sleep is not a uniform state. It is a carefully orchestrated cycle of different stages. This cyclical pattern is called sleep architecture. Sleep architecture is a fundamental component of overall health, with each stage serving a specific physiological and neurological function. Sleep is composed of cycles, with an average of 4 to 6 cycles per night, each lasting approximately 90 minutes. The cycle begins with light sleep, known as N1 and N2, where muscle activity slows, brain waves start to slow down, and the body begins to relax. As sleep deepens, slow wave sleep, or N3, is entered, which is the most restorative phase, crucial for physical and mental recovery. During N3 sleep, the body repairs tissues, boosts the immune system, and consolidates memories, ensuring waking up refreshed and rejuvenated. Finally, REM sleep is reached, characterized by vivid dreams and essential brain processes like memory consolidation, learning, and emotional regulation. Understanding sleep architecture is vital for diagnosing and managing sleep disorders. Abnormalities in the proportion or sequence of sleep stages can lead to or exacerbate conditions such as insomnia, which reduces the ability to achieve restorative sleep; sleep apnea, where interruptions in breathing fragment sleep cycles; psychiatric disorders, which are often associated with disturbances in REM sleep. Chronic sleep disruption has been linked to long-term health consequences, including cardiovascular disease, metabolic disorders, and neurodegenerative conditions. Sleep apnea, a common sleep disorder, disrupts the normal flow of sleep architecture primarily by interfering with breathing. It is characterized by repetitive, partial, or complete obstructions of the upper airway during sleep, leading to disrupted sleep architecture, intermittent hypoxia, and fragmented sleep. During sleep, muscle tone in the throat, tongue, and soft palate decreases. In individuals with obstructive sleep apnea, this relaxation leads to partial or complete airway collapse, or hypopnea and apnea, respectively. Airway obstruction results in reduced airflow despite continued respiratory effort, leading to hypoxemia, which then triggers an arousal response from the brain. Obstruction increases the effort required to breathe, creating negative pressure in the chest. Over time, this can strain the cardiovascular system. OSA disrupts normal sleep architecture by A. Reducing slow-wave sleep. Frequent arousals prevent progression into deeper restorative sleep stages, contributing to fatigue and poor physical recovery. B. Reducing and fragmented REM sleep. REM sleep is particularly vulnerable to apneas as muscle tone is naturally lower in this stage, increasing airway collapsibility. REM sleep disruptions impair emotional regulation and memory consolidation. C. Increased sleep fragmentation. Frequent awakenings result in non-restorative sleep, leaving patients feeling unrefreshed. Insomnia, another prevalent sleep disorder, manifests as difficulty falling asleep, staying asleep, or both. It can be triggered by various factors, including stress, anxiety, poor sleep habits, or even certain medications. It disrupts sleep architecture by reducing overall sleep time and compromising the quality of sleep achieved. People with insomnia often spend prolonged periods in light sleep stages, unable to transition into deeper, more restorative phases. This chronic sleep deprivation leads to a cascade of negative consequences, including excessive daytime sleepiness, impaired cognitive function, mood disturbances, and an increased risk of accidents and injuries. Over time, these effects can significantly impact one's quality of life and overall well-being. Insomnia and psychiatric disorders share a complex, bidirectional relationship. Sleep disturbances are a hallmark symptom of many psychiatric conditions, and conversely, chronic insomnia can exacerbate or even precipitate mental health disorders. Understanding this interplay is critical for effective diagnosis and management. Insomnia is often associated with increased arousal in the central nervous system, evidenced by heightened activity in the hypothalamic pituitary adrenal, or the HPA axis. Chronic hyperarousal contributes to mood instability, anxiety, and impaired emotional regulation. Dysregulation of serotonin, dopamine, and GABA, which are critical for sleep and mood regulation, plays a role in both insomnia and psychiatric disorders. Reduced GABA activity leads to heightened anxiety and difficulty initiating sleep. Circadian rhythm disruptions. Misalignment between the biological clock and environmental cues is common in depression, bipolar disorder, and schizophrenia, worsening sleep disturbances. Chronic sleep deprivation promotes systemic inflammation, which has been implicated in the pathogenesis of depression and other psychiatric illnesses. Psychiatric disorders. Commonly associated with insomnia include depression. Insomnia is both a symptom and a risk factor for major depressive disorder. Characteristics include difficulty falling asleep, frequent awakenings, and early morning waking or terminal insomnia. Chronic insomnia increases the likelihood of developing depression. Disrupted stage 3 and REM sleep exacerbate mood dysregulation. Insomnia frequently coexists with generalized anxiety disorder, or GAD, panic disorder, and post-traumatic stress disorder, or PTSD. Racing thoughts or excessive worry disrupt sleep onset. Hypervigilance leads to light and fragmented sleep. Poor sleep amplifies anxiety symptoms, creating a vicious cycle of worry and sleeplessness. Sleep disturbances are a core feature of bipolar disorder, varying with mood state. In mania, a person has reduced need for sleep and difficulty staying in bed. In depression, there could either be insomnia or hypersomnia. Sleep deprivation can trigger manic or depressive episodes by disrupting circadian rhythms. Sleep architecture abnormalities in schizophrenia include reduced stage 3 and REM sleep. Poor sleep exacerbates cognitive impairments, delusions, and hallucinations. Insomnia may signal relapse in stabilized patients. Nightmares, hyperarousal, and heightened reactivity to environmental stimuli disrupt sleep in PTSD. Fragmentation of REM sleep impairs emotional processing, prolonging the recovery from trauma. Sleep disturbances are a significant barrier to PTSD treatment outcomes. Individuals with ADHD often experience difficulty initiating sleep, restless nights, and daytime sleepiness. Dysregulated sleep-wake patterns exacerbate cognitive and behavioral symptoms. The clinical implications of sleep architecture are vast, influencing nearly every aspect of human health. A thorough understanding of sleep stages and their disruptions is crucial for diagnosing and managing a wide range of conditions, from sleep disorders to chronic diseases. By optimizing sleep architecture through tailored interventions, healthcare professionals can significantly enhance patient outcomes and quality of life. Thank you for watching. Follow the Insomnia Management series on this channel. For California nurses, opportunities for continuing education credits, or CEUs, are available at www.advancedpractice.io.